Welcome back. With me now is Nick Aquilina, President of the Malta Health Students Association. Hi Nick.
Hi Tim.
Yesterday your association released quite a strong statement with regards the vaccination process. What's your concern in a nutshell, please?
Our concern is basically that students have been given no definite answer of whether we are going to get the vaccine or not. A lot of students are working in high-risk situations, wards and ITUs, and we have families too, so I believe that we should get the vaccine along with the frontliners.
So, for those who may not know, health students get placements, right?
Yes.
And placements mean that you get to work in an actual hospital setting while you're still studying. During the COVID period, have the placements included COVID-related work?
Yes, they have. For example, a lot of my friends have worked in the ITU and have actually worked with COVID patients.
So these are people who are actually dealing with COVID-19 patients themselves?
Yeah, constantly.
And do you know of any who actually, so they're at high-risk situations.
Yeah.
Do you know of any students who actually got the virus themselves?
Yes, there's a specific cohort, I won't mention which one, quarantine constantly. They had to even fumigate kind of the entire faculty at some point because someone did actually contract COVID-19.
And even if they don't get the virus, there's also the risk of them quarantining as well, which is
which will
nothing
then
else.
affect their studies, and we don't want that.
And it's obviously a bit of a waste of time as well, right?
Yeah.
Do you know people who have had to quarantine more than once?
Yes, I do. I do. Like the same cohort. Their type of course is so hands-on that they do need to work with these people as it is kind of a requirement as well. So they are constantly working with them.
And do you work at the swapping centres as well?
I personally didn't, however I do know who
You
did.
as in students?
Yes, we have.
Okay. And at the moment, Malta is vaccinating the vulnerable people and the health workers. Now, we recently found out that teachers are going to be bumped up the list as well. How does this make you feel, and knowing that that health students haven't yet been prioritized at all?
I can understand teachers' point of view. Like, I do not want to show any disrespect whatsoever. That's certainly not my intention. However, again, with what we said in the statement is that we do want at least the government to try to consider having students vaccinated, especially those who are in the high-risk situations.
And how many times have you reached out to them?
We've contacted them quite a number of times at this point, and we've received no reply, or at least very dry answers.
Do you know what's going on in other countries? Have you looked at the situation there?
We have, however, specific to students, it can be quite difficult to get some concrete information with regards to our specific courses.
Okay, and there was a recent survey that was published yesterday which said that not students but young people are the most skeptical cohort in terms of the COVID-19 vaccine. Why do you think this is?
Social media, out of some websites may write their article related to some topic which can be controversial. These certain websites might not even have the full information, so these conspiracy theories are coming through, and young people can be quite impressionable, so then they opt to have this point of view.
Are you trying to launch some information campaign amongst young people about why they should take the vaccine when it becomes available to them?
Yes. In fact, one of our recent information that we have given to the public was about the influenza vaccine. Unfortunately, there's quite a bit of stigma about the influenza vaccine. So we're always trying to break those barriers so people get more knowledge, and we will follow suit with these vaccines that are coming up. And
finally, what's the, now we've seen the, teachers demanding that they get early access to the vaccine, now have health students. Is there a bit of a concern, do you think, that there's going to be a bit of a race, everyone wants to be first with this vaccine and there's limited stock for everyone?
I personally do have a bit of a concern. However, I do believe that the government and the health authorities will eventually kind of step up and do what is needed.
And then what's needed in this case is to vaccinate students.
Yeah.
All students or just the ones working on the front lines?
Our students are the ones working on the front lines. I can only speak for the students of the Faculty of Health Sciences, and we are constantly on the front line.
Do you know what's going on with the medical students?
Medical students do have their own association, however, I do know that they are working as well to get their students vaccinated.
Nick Aquilina, thank you so much.